Lawmakers of the Edo State House of Assembly in a plenary sitting. Parts of the day's business is the consideration of a letter from the state governor, Okpebholo, directing the lawmakers to investigate two ongoing projects initiated by the administration of his predecessor, former Governor Godwin Obaseki. The two key projects, the Radisson Hotel and the Museum of West African Art, MOWA, are both situated at the government reservation area and Sapele Road respectively. The letter signed by the secretary to the state government, Umar Musa Ihelo, was read on the floor of the house by the clerk, Audu Mogbai.
The house to carry out a thorough investigation of two critical projects in the state.
Following the reading, the Speaker of the House, Blessing Abibaku, announced that an ad hoc committee would be constituted at the next sitting to conduct a detailed investigation into the projects.
Two critical projects in those states. One of them is the Radisson Hotel, and the second one is the Museum for West Africa Arts, MOWA. This letter, by the power of the law, I want to put up ad hoc committee to look at the investigation of these two projects. The members of those ad hoc committee will then go tomorrow in these kind of channels.
Recall that both projects were awarded by the government of Obaseki and have come under scrutiny by the present administration over alleged inflated sum for the contracts and the state's stake in both establishments. While the contract fees for Radisson Hotel had been fully paid for by the immediate past government, the present government is at loss to the state's stake in the projects. However, the land allocated to MOWA has become contentious as part of Edo Central Hospital was demolished for the project. Also, the Assembly received another letter signed by the SSG requesting the screening and confirmation of nominees for appointment into the Edo State Judicial Service Commission. The Speaker referred the request to the House Committee on Judiciary with instructions to report back promptly. Meanwhile, the House passed for second reading a bill seeking to repeal the Edo State Private Health Facility Prohibition Law of 1984 and to establish the Edo Healthcare Regulation and Monitoring Agency to regulate healthcare facilities across the states.
So the intent of this bill, Mr. Speaker, is to see that we have a very strong of all the private health institutions so that they will be well regulated to see that, like I said earlier, China agenda will be achieved, the good health provision for our people. The government would allow private health practitioners to set their own rules, set their own laws, set their own standards, and do whatever it is they seek to do without regulation by government.
It is imperative for government to be involved in this process of standardization, because this bill is going to talk about bringing best practices in our private hospitals.
Mr. Speaker, this bill will ensure patients improve safety. It will ensure standardization, making sure the minimum requirement for standard practice is followed by healthcare establishments. Mr. Speaker, this will also help to bring quality care for our patients. It will also help to protect the vulnerable populations.
The agreement that this bill should scale this second reading, we say those against this bill is hereby health
Aweke, reporting for VOS TV News, Benin.